Morning students, here we can see some of the question answers of the OBG nursing. The fertilized ovum implanted in the dash stage in the uterine cavity. It is in the blastocyst stage. The shape of human placenta is discoid shape. Weight of mature placenta is 500 gram, or it is almost 1/6 of the baby's weight. A term that diameter of the placenta is that centimeter and thickness of placenta is that centimeter. It is all the diameter is almost 15 to 20 centimeter and the thickness is almost comes as 2.5 centimeter. The fetal blood flow to the placenta at term is almost 400 ml per minute. The specific gravity of amniotic fluid is 1.010. Color of amniotic fluid at term is pale straw colored. Amniotic fluid looks turbid due to the presence of vernix gaseosa. Meconium stained amniotic fluid is dash in color. It is green in color. In RH incompatibility, the amniotic fluid is in dash color. It is in golden color. The greenish yellow amniotic fluid is in post maturity. Dark colored amniotic fluid is in concealed hemorrhage. The dark brown or tobacco colored juice amniotic fluid is in case of IUD intrauterine death. Fetal skin covered with vernix gaseosa and lanugo from dash week onwards, from 20th week onwards. Both testes descend into the scrotum in 40th week. Mean cardiac output in the fetus is the dash ml per kg per minute. It is almost 255 ml per kg per minute. Within 1 or 2 hours after birth, the mean cardiac output is estimated to be 500 ml per minute. The heart rate of newborn comes almost 120 to 140 beat per minute. The hematopoiesis is first seen in the which organ by 14th day? It is in the yolk sac. Fetal HB is called as fetal hemoglobin or HbF. HbF have higher affinity towards oxygen due to the lower binding of 2,3-diphosphoglycerate. Total fetal-placental blood volume at term is 125 ml per kg. The lifespan of fetal RBC at term is almost 80 days. The maternal immunoglobulin that crosses the placenta is IgG, that is from 12th week onwards. Near term, the urine production of the fetus rise up to 650 ml per day. The sebaceous gland appear at 20th week. The meconium appears from 20th week onwards. The surfactant is secreted by type 2 alveolar cell. The surfactant appears at 24th week. The breathing movements appears at 11th week. Lecithin spongium myelin is the dash in the amniotic fluid signifies the fetal lung maturity. The ratio is 2.1. The natural trigger for surfactant synthesis is fetal cortisol. The hormone produced from fetal pituitary is from 10th week onwards. Fetal pancreas secrete insulin by dash week and glucagon by dash week. Insulin by 12th week and glucagon by 8th week. The pregnant uterus weighs the non-pregnant uterus weighs nearly 60 gram. The pregnant uterus weighs at term is 1000 gram. The length of non-pregnant uterus is 7.5 centimeter. The length of a pregnant uterus is 35 centimeter. Shape of non-pregnant uterus is pyriform in shape. The shape of uterus at 12th week is globular. The shape of uterus at 28th week is pyriform globular. The shape of uterus beyond 36th week is spherical in shape. Normal position of the uterus is anteversion and deflection. The lining of pregnant uterus is decidua. The lining of non-pregnant uterus is endometrium. So this endometrium during pregnancy is called as decidua. Irregular, infrequent, painless uterine contraction during pregnancy with no effect on cervical dilatation is called as Braxton Hicks contraction. The sebaceous glands become hypertrophied around the nipple during pregnancy is called as Montgomery tubercle. The pigmentation around the eyes, cheek, forehead during pregnancy is known as pregnancy mask, otherwise chloasma. The brownish black pigmented area in the midline stretching from the xiphoid process to the symphysis is known as linea nigra. The depressed linea marks found in the abdominal wall below the umbilicus, thigh and breast, pinkish during pregnancy is called as stria gravidarum. After delivery, the stria gravidarum become white in appearance is called stria albicans. Thank you. Thank you for listening.